Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. So today we have the Pan-American Health Organization, or PAHO, with Dr. Etienne and her team. And while she talks about COVAX and a need for us to be able to get a hold of those vaccines and for our health officials to set up appropriate systems to vaccinate people and in appropriate order, so that we, starting with healthcare providers to the most vulnerable. She also says that we should not actually depend on that vaccine to be the magic bullet, the silver bullet, as she put it, to take care of everything for us. We still need to observe the hand washing, the social distancing, and all the other measures that we have been taking, including wearing masks, and to ensure that we don't continue to spread the virus. As we know that from the WHO that their goal is to produce 2 billion doses by the end of 2021. Keep in mind that there are nearly 8 billion people on our planet. So 2 billion is 1/4 of the people that are currently living on our planet will be vaccinated. So keep that in mind, that we still need to, while we're in this pandemic, we still need to observe all of the measures that we have been doing, keeping our bubbles small, hand washing, and social distancing, wearing a mask. So, with that, let's listen to what Dr. Etienne has to say, and the entire PAHO team in various countries.
Based on the data and science to earn the public's trust. For years, PAHO has been working to build regulatory capacity across our region through new technologies, techniques, and expertise. Through this pandemic, we have also been in frequent contact with regulators across the Americas, so that they are aware of the latest COVID vaccine science to inform the steps that are needed for approval. And we will be supporting countries to monitor the vaccine safety and effectiveness over time, and to assess whether vaccination plans need to be adjusted. The goal of early vaccination could be to reduce deaths and suffering from this virus, and to minimize the risk of infection while protecting our health systems overall. And that is why it is recommended that frontline health workers, first responders, and those caring for the elderly would be vaccinated first, followed by vulnerable groups such as adults with pre-existing conditions, especially those over 65 years of age. The challenge lies in identifying these groups early and determining how to best reach them. Our seasonal flu campaigns, which this year alone have protected more than 70 million people across our southern hemisphere, offer a good blueprint. Immunization programs will have to be adjusted so they meet the demands of a COVID-19 vaccine. Just as essential services are being offered outside of traditional settings, vaccination strategies must be designed to minimize the strain on our clinics and hospitals without sacrificing convenience and access. To ensure vaccination sites aren't overwhelmed, they must have adequate staff, resources, and equipment in place. Scheduling will also be important to control foot traffic and maintain social distancing. The success of vaccination also rests on how information is shared. Governments must provide clear guidance about the vaccines and their vaccination strategies to instill trust and to minimize confusion. Misinformation during vaccination activities costs lives. So we hope scientists do uncover an effective vaccine that offers lasting protection against COVID. But it may take a few tries before we find the right one. But even when we do, it may take time before people are vaccinated. But this virus will continue to spread, and people will continue to get sick even as a vaccine is being rolled out. So we cannot pin all our hope on vaccines alone.
As is the case very often in public health, there are no silver bullets. We'll still need diagnostics to identify those who are sick and better treatments to care for those that fall ill. We will continue to rely on traditional public health measures like testing, contact tracing, and quarantines to minimize the spread of this virus. And we will continue to count on people exercising social distancing, washing their hands often, and wearing masks in public to protect others from getting sick. So let me take this opportunity to urge countries around the world to prepare for a corona vaccine, but also to remain realistic, knowing that these preparations do not replace everything else that we must do to save lives today. Thank you so much.
Muchas gracias, doctora
Thank
Etienne.
you very much, Dr. Etienne. Now we are going to move on to the questions, and we have received them via email and via chat. Please remember that you can use the Q&A button to ask your questions, and you can do that in English or in Spanish. And please do identify yourself by name and also by referring to your media outlet. The first question, and as a follow-up to what Dr. Etienne just mentioned, several journalists asked us how many countries in the Americas have joined COVAX. Dr. Etienne.
Thanks for that question. So let me begin by saying that one of the important things to keep in mind about an eventual vaccine for COVID-19 is that when dealing with a pandemic, no one is safe until everyone is safe. And while it is normal for leaders to want to protect their own people first, the response must be collective. The COVAX facility is truly an unprecedented global effort to ensure that when a vaccine is available, each country in the world will have access to it as quickly as possible. So the more countries and territories that join the COVAX initiative, the better for all of us. As I mentioned in my remarks, according to the latest information that has been provided by COVAX facility on the 21st of September, 156 countries, including 64 self-financing countries and 92 countries that are eligible for financial support to procure the vaccine, have sent their letter of intent to join the COVAX facility, and more are expected to follow. From the Americas, 14 self-financing countries and territories have committed, including Argentina, the Bahamas, Belize, Bermuda, the Cayman Islands, Chile, Colombia, Panama, Paraguay, Peru, and Suriname, St. Kitts and Nevis, Turks and Caicos, and Venezuela. In addition, a further 10 PAHO countries are eligible for the COVAX AMC support. These include Bolivia, Dominica, El Salvador, Grenada, Guyana, Haiti, Honduras, Nicaragua, St. Lucia, and St. Vincent and the Grenadines. And furthermore, Antigua and Barbuda, Brazil, British Virgin Islands, Costa Rica, Cuba, Dominican Republic, Ecuador, Guatemala, Jamaica, Mexico, Montserrat, Trinidad and Tobago, and Uruguay have also submitted confirmation of their intent to participate. That's some 13 more countries and territories. So many more countries from our region have also expressed an interest in joining and have asked for an extension from Gavi. So we're expecting that this number will increase in the upcoming days and weeks. I dare say this is a really positive response from the countries of the Americas. Thank you.
Gracias, doctora.
Thank you, Dr. Etienne. Next question was emailed to us by Natalia Ditela from Reforma in Mexico, and she was asking, what is the challenge that the health systems will face in Mexico given COVID-19 and the flu season, and also what are the measures to be implemented in addition to the flu vaccine? Dr. Barbosa. Thank you for this question. The risk is to have during the flu period a dual burden on the health services. In winter, we have the highest transmission of influenza, and health services may already have also a higher burden of people who are looking for services or care because of flu or, for example, bacterial pneumonia as a complication of the flu. It is important to administer the flu vaccine and also to reach out to the people as we recommended for the countries in the southern hemisphere, and they did so in July and August, and we were able to attain good coverage rates in the southern hemisphere, and we avoided overwhelming the health system. So the same has to be done in Mexico and in the other countries to guarantee high coverage with the flu vaccine, in particular among high-risk groups such as the elderly and people with chronic conditions. It is also important to maintain the measures that protect against COVID-19. The flu virus is a respiratory virus, so we also need to continue to implement social distancing, hand washing, and also wearing masks that could also prevent flu transmission. Thank you. Thank you very much. The next question is by Matias Loewe from Argentina, and he's saying that in Argentina, several relatives or family members feel that their COVID-affected family members were isolated during weeks in ICUs. Does WHO have a protocol for the right to fare well, a right to be with those relatives? Thank you very much for the question. This is a very important question. The desire to be with a loved one before that person dies is one of the deepest human feelings, and it has to be managed with care and respect. Throughout the pandemic, we have had experiences at the hospital level in Israel, Spain, Korea, whereby by using strict protocols, very close relatives were able to say goodbye to their loved ones. Argentina has been implementing new measures, and we know of the law implemented in the city of Buenos Aires so that loved ones and family members may be with their dying relatives, but we need to follow protocols, and Argentina has implemented that action by using personal protective equipment, and also the protocol also includes not allowing people older than 60 years of age or with underlying conditions that may lead to COVID. So there is a balance, and countries need to implement their measures. It is allowed as long as we take into account the measures, social distancing, because the person cannot be touched. And I think that the protocol that is being implemented in Buenos Aires, in the capital, and also in Greater Buenos Aires is important, but it should be implemented with extreme caution, because there are other conditions also with management of the corpses. So given if a death is unavoidable, they can also resort to video conferencing to be able to be in contact with our loved ones. And we know that it is difficult, but we think it is viable. And we also congratulate Argentina on that protocol, because as long as it is due care by following international recommendations, it may be allowed for those loved ones to be next to those who are dying. Thank you very much, Doctor. The next question comes from Daniel Collins from TN23 in Guatemala. He's saying that Guatemala is announcing a second potential wave of transmission, but the data provided by the authorities indicate a decrease in the red areas. What is the recommendation based on the situation? Dr. Ugarte. Thank you very much, Sebastian. This is a very important question, and it is also applied to other countries, in Guatemala in particular, and also based on the data published by the Ministry of Health through their surveillance dashboard on COVID-19. They also indicated a significant reduction over the last 2 weeks, and also the number of positive cases. The rate of occupancy at the ICU level has also been maintained at 21% in general at the hospital, and then at the ICUs at 50%. With the reduction of cases, the population also considers that they have more freedom from those restrictions of movement and protection measures. It is important to indicate that in Guatemala, for example, the positivity rate of tests is still quite high, between 20 and 25%. It is decreasing, but it is still high. That means that there is a high number of the population that is still vulnerable, and if we lower our guard, the number will increase. And this is something that Dr. Barbosa, our director, have already explained, as well as Dr. Marcos Espinal. We need to implement protection measures such as social distancing, wearing masks, and washing hands. And we need to pay attention to people who are vulnerable because of related conditions, because of age, because those are the individuals who will suffer the most. It is important for all of the countries that are currently witnessing a decrease in the number of cases continue to be vigilant, to implement protection measures until we see a significant reduction of cases. In the case of Guatemala, cases may increase as well as in other countries. We see the example in Europe where they had a low count for several weeks, and after the economic reopening, there was a significant increase and the measures were further restricted in several countries. Thank you. Thank you, Doctor. The next question is by Clan Smith from Bahamas. The question is the following.
Recovered COVID-positive patients do not have any antigens after quarantine? Dr. Alighieri?
Thank you, Sebastian, for this question. I would guess that the question is more about antibodies than antigens. I mean, about immunity and the detection of antibodies in patients that were tested positive, PCR positive, and have been isolated during their disease. The short answer regarding antibodies is that in some laboratory positive patients tested positive by PCR that have mild or moderate disease, as in very mild symptomatology, it is possible not having antibodies detected by the existing techniques after the disease. These patients, after completing isolation, would be tested negative for antibodies. This situation is not likely to happen to patients with severe or critical disease, COVID-19 disease. Thank you.
Muchas gracias, doctor.
Thank you very much, doctor. The next question is from Annalisa Paul.
Guardian newspaper. She wants to know additional information on PAHO's WHO continuing efforts as the global death rate raises to 1 million. She also sees that the UK has implemented additional restrictions and hinted that they could remain in place for as much as 6 months. How is the rest of the world progressing in their respective efforts? Doctor Barbosa, ¿podría tomar esta pregunta?
Yes, thank you. Thank you for this question. I think that this is a very important one, that we are still facing a very important public health threat. We are seeing now in Europe, countries that had the first wave in the last week of February, first week of March, that are now facing a second wave after releasing some measures after the summer, after opening up the economy. So even countries that have reached a very good control of the transmission are now facing this new wave. The cases are increasing. In other countries, such as in the Americas, we have a mosaic of situation. Of course, that was highlighted by Dr. Ugarte. Even countries that are now experiencing a reduction in the number of new cases, of daily new cases, it is the level of transmission is still very high in almost every country in the region. So we cannot take for granted that the battle is finished. On the contrary, I think that it's very important to monitor very carefully what's happening with good surveillance data, see what is the trend, see what are the measures that have been effective, see what are the measures that need to be improved. This is the reality that we have. The world is dealing with COVID-19 since January, and probably we will have many months in the near future that we will need to deal with this pandemic. So it's very important when we are reaching these very sad figures to see many lives that were taken due to COVID-19. This is, I think, that it should be a call for action to remind all the governments, to remind the societies that we need to keep the effort, that you need to be more collaborative, that we need to be to strengthen all the instruments that we have to prevent the transmission, to control the transmission, and to save lives in the near months that we still will have to deal with COVID-19 pandemic. Thank you.
Gracias, doctor. Tenemos varias preguntas
Thank you
vinculadas.
very much, Doctor. We have several questions linked to Argentina. One is by Juan Manuel Nievas, who is with Shinshua in Argentina. He is saying that Argentina is approaching the summer season. We have a higher number of deaths and cases, and we have no definitions about tourism in the country during summer. How do you envision the new normal for this sector? He would also like to know what is PAHO's assessment as to the cooperation between China and the countries of the region in connection with the pandemic. Dr. Espinal. Thank you very much for this question, Juan Manuel. As we have seen, countries that are currently in the summer season with a very strong tourism industry, such as the Caribbean and other regions, have had a mass increase of cases. So clearly, during summer, the tourism industry will be affected. Argentina is going through a very strong and difficult situation, and we cannot say that they have reached the peak. I think that yesterday 12,000 cases were reported, and it is important to focus on the measures. We cannot expose tourists, but also Argentinians, so they will see an impact. As to the China cooperation, and I think it refers to the offer by the Chinese president yesterday when he was speaking at the UN about best practices for the countries. PAHO welcomes all of the best practices, north, south, south, and multi-country cooperation. Anything that could benefit the countries, any practice that may benefit the countries are welcomed by PAHO. Countries are sovereign, and they do decide what type of agreement they may want to enter into with their partners. So it is their decision, the country's decisions, to enter into agreements with other countries outside the area. But if that will help best practices, please go ahead. But PAHO will always work with countries on consultations regarding those best practices, because it is always a good idea to confirm based on the best evidence of public health. That's the reason why our country offices will always be available to the countries and to everyone to be a catalyzing body as part of those consultations and agreements with other countries in the region, and that is welcome, and that is part of the best practices.
Thank you very much, Doctor. And the next question is from Jerry Diaz from Guyana. And it's
used to treat COVID-19 patients in India, remdesivir and tocilizumab, are scarce and cost at high rate. How could this drug production be accelerated in other countries too? Dr. Aldiguieri?
Thank you for this question from Guyana. We are talking about two different classes of medication, remdesivir and tocilizumab. Both medications are going through very strict randomized clinical trials at this moment. The remdesivir is part of a solidarity trial sponsored by WHO, and we are expecting soon first analysis and publication of results. Regarding remdesivir, also 3 other articles and publications suggest that remdesivir may reduce the mortality and improve the time to symptom resolution. For tocilizumab, further research is needed. But in both situations, if there are good results and evidence of evidence regarding reducing the mortality for these medications, there is a key role for public-private partnership for increasing the production of field proven medications. And the mechanism for catalyzing this good private-public partnership already exists, and it's part of the ACT accelerator, which is coordinated by WHO with a participation with other partners, and it deals with the accelerator for new diagnostic, new treatments, and vaccines. Thank you.
Gracias, doctor. La siguiente pregunta es de Mariana.
Thank you, doctor. The next question is from Mariana Barros, Medio TV, Venezuela, and it says, by when do you expect to have the sending of tests and biosecurity materials to Venezuela? And also, what is PAHO's opinion on the upcoming election cycle on December 6th in face of the uptick in COVID cases in Venezuela? And what kind of recommendations does PAHO have? Do you think this will be a risk? Dr. Ugarte? Thank you very much for that question. The situation of availability of testing continues to be complex, and the same goes for the purchase of reagents. And that's why PAHO has been sending both to Venezuela as well as a host of other countries about 17 million tests, and over half of them have been donated. In the case of Venezuela, we are using the resources that we have from several projects, including those coming from the agreement signed between the Ministry of Health and the Assembly. And in that framework, we are going to send antigen tests coming from Korea that will be arriving in early October. It's 10 readers and cartridges for hundreds of tests, and this will enable Venezuela to increase the number of daily tests performed to 6,500, more or less. Now, in terms of the election cycle, as we have said in the past, we need to find a balance between the right to health and right to life and the right to vote. So, in that sense, it is imperative to make all the necessary precautions to reduce transmission in all the people that will go to the polls. We have seen very positive experiences in several countries that went through election cycles. However, in pretty much all of the cases, we saw an increase in new cases about 2 weeks post-election. So some countries have made decisions to ensure that health services are available to receive this increase in cases. In the case of Venezuela, so you need to take all the necessary precautions because the health care systems and services would not enable to receive a massive spike in the number of new cases. However, we are still far from the election date, and so you need to use this time to make all the necessary precautions, to take all the necessary precautions so that the people can vote, but while protecting your people's health and right to life. Thank you. Thank you, Doctor. The next question comes from Ludmila Chernova, correspondent from Sputnik News. And the question says,
situation with the COVID-19 in the region. Is the situation getting better or worse? She also asked about second waves and what are PAHO main concerns. Dr. Barbosa?
Thank you for the question. But you know that it's very difficult to summarize the very different situations that you have in different sub-regions, North America, in Central America, in the Caribbean, in South America, because we have very different situations. But when you see, for instance, in Latin America, sometimes I think that the people, we had the first pattern of transmission in China and after China in Europe, and we try to understand the other waves of transmission are similar to this one, but they are not. Let me show you I'll try to show a a picture, a graphic here, but I need the host to allow me. But in Italy, for instance, or in New York here, or in Spain, we had a very rapid increase in the number of cases. So it produced a curve that was like the inverted V. In Latin America, the situation was different. Latin America countries, the transmission started later. So they had time to implement many measures that reduced the speed of the transmission. But at the same time, probably related to poverty, to the informal economy that our countries have, and other socioeconomic determinants, they were not able to control the transmission. So the curve, when we look at the curve in Latin America, it's more like a plateau. So even now that it is reducing, but it is still in a high level. So we need to see what is happening, not only in the region, but in every country, and even within the country. We have in many countries, such as the United States, or Mexico, or Brazil, or Argentina, or Chile, in many countries that the situation is reducing the transmission in some provinces or states, and increasing in other ones. I think that the most important thing is to monitor the situation and to adapt the strategy to face the transmission, the level of transmission that you are facing. So if you detect that there is a new increase, you need to act very fast to see what is producing that increase, how the social distancing measure can be more effective in order to control the transmission. Thank you.
Muchas gracias, doctor. Siguiente pregunta es de Jenny Ravelo.
Thank you, doctor. The next question comes from Jenny Ravelo in Mexico, and it says,
COVID-19 are from the region. What's driving these numbers? Is it the overwhelmed health system, shortages in equipment or health workers, inaccessibility of treatment, or too many falling ill with underlying health conditions? Doctor Espinal, ¿podría tomar esta pregunta?
Muchas gracias. Creo que se contesta la pregunta. Es una combinación
Thank you. The answer is a combination of all of your things you mentioned in the question, plus other factors as well. Our economies have been hit hard by the pandemic. The informal economy is very widespread throughout Latin America. We have cities that are hardly urbanized with poverty belt, where it is very hard to practice social distancing. So basically, it's a combination. Health systems with their weaknesses and strengths, and also let us remember that the pandemic mostly kills people over the age of 60, or people with pre-existing conditions such as diabetes, cancer, or cardiovascular disease. So it's a combination of factors, and this once again shows us how unpredictable this virus is, because we continue to see deaths. The curves are kind of flattening little by little, but that doesn't mean that we need to relax the measures, because we also see new spikes in Europe. And this is because unless and until the vaccine is available and more medicine and treatment, we need to continue implementing these non-pharmaceutical measures and finally balancing reopening in order to minimize the number of deaths. Thank you. Thank you, doctor. And the next question comes from Narcia Perdomo from Criteria on Honduras, and it says, what can we expect in terms of health in countries where COVID-19 tests are not performed in a widespread manner in the population? Dr. Alighieri, could you answer this question, please? Yes, thank you. And this question and answer goes for every country in the region at this time, with no exceptions. The risk of not being able to broaden the coverage in terms of lab surveillance means that we will not be able to have an exact idea of what the trends are for outbreaks, and also not being able to implement and adjust public health measures. This is a big challenge that impacts the primary first level of care, which is the key to address the COVID-19 in our region. We have, however, some good news in terms of expanding the lab network and to supplement the gold standard, which is PCR testing, which entails a huge logistical nightmare, so to say. So this game changer is the introduction at the primary care level of antigen detection-based testing. Dr. Ciro Ugarte, when he talked about the response in Venezuela, mentioned this key aspect, that is to say, the introduction of antigen-based tests. This is a game changer that came about over the past few months, and it's the first change in terms of our operating strategy. And so all countries right now need to take that opportunity and invest in purchasing antigen-based testing that supplements, that does not replace, but it supplements the existing networks that use PCR testing. Now, a significant limitation for these tests is that they can be used with patients that are symptomatic. That is to say, they're not tested to be used on asymptomatic patients. Thank you for your question, and I hope I provided you with the right guidance. Thank you. Thank you, Doctor. The next question comes from Scott Smith, AP correspondent, and it says,
the most to provide adequate doctors to treat the influx of patients suffering from the coronavirus? And also, what is the impact the shortage of doctors has had on these countries to meet the need of their citizens sick with coronavirus? Doctor Ugarte, ¿podría contestar?
Yes, thank you, Sebastian.
Could you answer? Yes.
It applies also to many countries. And actually, most of the countries in the world with developed and developing health systems have struggled to have enough human resources to meet the needs. This was much more important, of course, in countries where the human resources management was not as developed and did not have enough medical doctors, nurses, etc. And during the first months of the COVID-19, there was, with a sharp increase of number of cases, particularly on critical care, those medical doctors, nurses, technicians, and others were not available. And so the countries had to increase their capacity for critical care, and several of those countries filled their gaps in different ways. For example, relocating staff from other services with task shifting, taking executive steps to hire additional staff. Also, they accelerated the graduation of senior residencies and health careers, for example, temporary contracting of health workers, and even given license to foreign medical doctors. And with that, the countries were able to expand the capacity. But as you have noticed, during those months, the number of deaths was very high because the availability of intensive care units were not there when it was most needed. Now, you see the number of deaths in proportion are reducing, although I would like to highlight that during the last 7 days, the region of the Americas have reported 52% of all the new deaths in the world. So that also is a good explanation why we need to continue expand our health systems. And this is, it has certainly also an effect on the delay and even suspension of other services. We are talking about COVID-19, but we need to talk about many other factors. So it is a huge challenge for non-COVID patients to reach the hospitals and to receive proper care. And this is also a call to strengthen the health systems and health services, particularly at the level of primary health care, but also to ensure that the investment in health services is strong for the time being, for the future. And this is, we are seeing this particularly because many other essential health services have been suspended because of the lack of enough human resources for health. Thank you.
Gracias, doctor. Siguiente pregunta nos
Thank
llegó.
you, doctor. The next question comes from Mirina Ochoa from Uno TV in Mexico. And the question is, faced with these new outbreaks of COVID-19 in Europe, does PAHO expect to see new outbreaks in Mexico? And if so, on what month? Other journalists are also asking about second waves in their countries and new peaks and what is to be expected and whether it's possible to prevent these situations. Dr. Barbosa, could you answer? Yes. First of all, let me address the issue of the waves. If you can see the screen, this is for Italy, but the same goes for Spain, for New York, etc. So what do you see here? There's a very sharp increase in transmission at the end of February, and then right here, all the social distancing and wearing masks are passed. They're very effective, and within a matter of 3 to 4 weeks, we start seeing a sharp decrease in the number of transmissions. Then transmission continues, but low, and now we're starting to see what we call this second wave, which will be stronger in countries such as the UK or Spain. So this is one situation for Italy. Now we see Peru, but this could be any other country in Latin America. We can see that the curve is different. Transmission started much more slowly because the countries had a head start and they did implement these measures that were aimed at reducing transmission. So in Manaus, Brazil, or Guayaquil, there were some spikes, but in the majority of the cases, this was the progression. It started a lot slower, more slowly. We did not see an explosion in cases like we saw in Europe or New York, but transmission continued over a much longer period of time, be it due to poverty or because of the informal economy. But social distancing measures that were adopted were important to reduce transmissions, to flatten the curve, but they were not effective in reducing the curve altogether. So in those cases, it is important to keep all the necessary care actions and maintain the actions to reduce and control transmission. And I'm sure that in countries such as Mexico, where we saw several weeks in there, or Brazil with the reduction, like we saw, the transmission level continues to be very high. Transmission is not under control, and we need to keep all of the measures in place. And we need to monitor the cities, the provinces, the states, because having a new outbreak is a possibility. And European countries taught us that that is very likely. So we need to be prepared and vigilant, especially in the localities where transmission is thought to be under control. Thank you, Doctor. The next question in the chat comes from Marina Teodoro Machado from Terra, Brazil. And it has to do with self-medication. And it says,
An old but still current problem in many countries became even stronger in Brazil in face of the COVID-19 pandemic, when many people started taking over-the-counter medications or started off-label treatments without proof of effectiveness in order to protect themselves from the virus. As she's asking, what is the organization's opinion on this phenomenon? Doctor Espinal, ¿podría contestar?
Thank you very
Dr.
much.
Espinal, could you answer?
The view and the opinion of the organization is that self-medication is not recommended. There is no medicines fully approved against COVID or vaccine, but we're talking about medicine. So before self-medication, people should contact their providers, their hospitals, and their public health local websites of the Ministry of Health to explore if there is anything recommended. But there's nothing yet recommended except for one or two medicines that are only used in hospital setting for people affected, seriously, severely infected and affected by COVID, that in very advanced stages. But these medications are only used under prescription in hospital settings and intensive care unit. So when the medicines are studied and the data are available, the organization will be the first to recommend any new medicine that will be available for that. But in the meantime, the organization does not recommend self-medication. Off-label, for emergency humanitarian purposes, there are protocols on that, and there are recommendations that the governments needs to look into it. And for that, PAHO has also recommendations and WHO. But at the moment, there is no medicines approved for COVID, except couple, as I said, for hospital settings, and it is not recommended self-medication. Thank you.
Gracias, doctor. Estamos llegando ya.
Thank you, doctor. We're nearing the end of this media briefing. And there's one more question from Alberto Cabeza that says,
Borders closed in the region. What measures do you recommend to prevent COVID-19 among migrant populations? Dr. Etienne?
So, thank you for what is a very important and pertinent question for our region. So, as we know, several countries in Latin America and the Caribbean have significant migrant populations, not least along the borders with Venezuela. In recent weeks, there have been spikes in the number of reported cases of COVID-19 in some border areas, and this highlights that migrant populations are particularly vulnerable to transmission. There have also been reports of large number of migrants returning to their countries of origin. But what is key is that regardless of whether a migrant is remaining in one country or returning to another, they must have access to testing and treatment, as well as support in adhering to the public health measures that have been put in place to prevent community transmission. Now, countries must also ensure that individuals who are sick or suspected to be sick with COVID, as well as their contacts, are quickly identified and isolated to minimize the chances of transmission to others, no matter where they are living. And that's important. To support countries, PAHO has developed guidelines for national authorities on coordinating the return of migrants across borders, which highlights the need for training of personnel, maintaining physical distancing, identifying those migrants most at risk of severe disease, and most importantly, for cross-border collaboration. I regularly highlight the spirit of solidarity for which our region is known. But when it comes to migrants, exercising this solidarity is absolutely vital for reducing transmission. And countries must continue to work together to ensure that everyone has the right to health. Thank you very much for being with us this week again.
Muchas gracias, doctora Etienne. Muchas gracias a
Thank you
todos.
very much, Dr. Etienne, and thank you everyone for joining us for this session. Very briefly, we will be sharing with you the director's remarks as well as a recording of the session. And next Wednesday, we will not be having this press briefing because that week we will have our executive council session for PAHO, and we will be sending you more information on this. So we will have our next press briefing on October 7th. So thank you very much again for joining us, and remember that all of the information on coronavirus virus response in the region and data on cases and deaths can be found on PAHO's website. Thank you very much once again, and have a good day.
Okay, so there's been a lot of talk about which wave of the virus that we are in, and so we did manage to get some answers around what a wave of the virus actually means, and what it means to us versus what it might mean to a health official. And they answered with a curve, and as we see the number of viruses peak and then die down, that would start to indicate a wave, especially if the number of viruses started to come back up again, thus creating the second wave. And there was another example, of course, where the curve never really died down. Now, for us here in Canada, because we managed to pull the curve down, we bent the curve early, and we kept the number of infections down, especially in areas like British Columbia, who really did one of the better jobs of bending the curve down and keeping the number of infections down. It's tough to say if you're in the first or second wave of things because of it never really died completely down, or never really spiked completely up. So, but it doesn't change the basic things that we need to still maintain: the hygiene, the face mask wearing, and we still need to keep the social distancing up in order to keep the virus itself under enough pressure that it doesn't spread, say, like wildfire through our community. So as long as we keep attention to those items as the public, we are doing our part to keep infections down. So thank you for listening today. You've been listening to Depictions Media. This is Policy and Rights, and I am Michael. So if you want to keep getting updates from us and more information from groups like the WHO and PAHO, as well as provincial things, especially if you live in British Columbia, please do click that subscribe button so we can continue to send you more and more updates about what is going on around us. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.